So welcome to today's webinar on understanding dementia, recognizing signs, providing support. Just a bit of generic housekeeping to start with. To get the most out of this session, we just want to make sure that you have a strong internet connection. So check that you don't have a video playing on a different browser tab or on another device. Next, there are the Zoom reactions, which you should be able to see in the toolbar. So you can just send some of those through. Great, I see some of you have found them already. So just keep those coming through while the presentation is going. It's great to see what you're loving and when you're learning something new. Next, this will be important for the second half of the presentation, the Q&A function. So throughout the presentation, you can submit questions through the Q&A, which is also accessible in the toolbar. So please submit your questions through the Q&A rather than through the chat, and upvote questions that you would like to see answered, because in the Q&A time, we'll prioritize the questions which have the most upvotes. So for those of you who are new or who don't know much about the Brain Foundation, I'd just like to talk a bit about what we do. So our primary goal is to fund high-quality Australian research into brain diseases, disorders, and injuries, with the ultimate goal of improving patient outcomes. Secondly, we provide medically reviewed resources about brain conditions that anyone can use to learn more about a particular disorder. And this includes the articles on our website and also resources like this webinar, and our other Brain Awareness Week content. And lastly, we raise awareness about the impact of brain diseases and advocate for patients. Next up, I'd just like to highlight a service that we support. And the Brain Foundation funds research, but we also get asked sometimes if there are opportunities to participate in research. So on that note, we're an organisation champion for Step Up for Research. This is a one-stop shop that connects people who are interested in dementia or aging research with studies that they might be able to take part in. Volunteers simply sign up online or over the phone and provide information like their age, where they live, and any health conditions they have. Anyone over the age of 18 can sign up, and it's totally free to use. There are studies added to Step Up for Research every week, and lots of different opportunities to be matched to a study. It might be a short interview or a survey, or even a drug trial or thinking and memory tests. And so by signing up, you can choose which studies you're interested in, and contribute towards life-changing dementia and aging research. So yeah, if any of you are interested in being a part of research, this is the place to go, and you can sign up with the details on the slide. So who is this presentation for? Just to make sure we're all in the right place today, this webinar is for anyone who is interested in improving their brain health, if you want to understand more about common brain diseases, disorders, and injuries, and also if you want to ask a question with today's expert. And today's expert is Dr. Suraj Samtani. He is a postdoctoral fellow at the Centre for Healthy Brain Aging and a clinical psychologist. Dr. Samtani has an interest in social connections, cognition, and social determinants of health and mental health in older adults. His research includes long-term analyses of cognitive aging to identify risk and protective factors for healthy aging, and also developing new interventions to help older adults stay socially and mentally healthy. He's worked on a number of significant long-term studies, both in Australia and internationally. So you can read more about these on the event page on our website, where his bio is. And lastly, I'd just like to introduce you a little bit about myself. So my name is Anik, and I'll be hosting today's webinar. I'm the grants manager and digital lead, and I've been at the Brain Foundation for nearly 5 years now. So I oversee our grant application process and also write a lot of our website content and newsletters. And today we also have Vanessa Mundell moderating the chat. Vanessa is the fundraising manager here at the Brain Foundation. So if you have any questions or issues today, just ask in the chat and Vanessa should be able to help. And without any further ado, I'll let Dr. Samtani start the presentation.
Welcome, everyone. I'm Dr. Suraj Samtani. I'm a postdoctoral research fellow at the Centre for Healthy Brain Aging at the University of New South Wales in Sydney. And today we're talking about understanding dementia, recognizing the signs, and providing support. So welcome everyone to Brain Awareness Week. I would like to start off by acknowledging the traditional custodians of the land from where I join and from where all of you are joining, and acknowledge leaders past and present. So a little bit about me. My name is Suraj. It means the sun in Hindi. I'm a clinical psychologist and I'm also a researcher here at the University of New South Wales. And when I'm not doing these roles, I also work as a music teacher. So that's a little bit about me. So I'm very thankful to our team, the very talented team that we have here at the Center for Healthy Brain Aging. We have our two co-directors, Professors Henry Burdati and Parminder Sachdev, and I'm very thankful to the efforts of everyone involved in the research studies that I'll be talking about today. So Sally Mahalingam and Nicole Casey, Darren Lipnicki, and Ben Lam. So who are we? At the Center for Healthy Brain Aging, we are a self-funded research center within the University of New South Wales, and our vision is to achieve healthy brain aging and better clinical care for brain diseases like Alzheimer's disease and other dementias. So our ultimate goal is for healthy brain aging for all Australians. And we have a number of longitudinal studies where we follow people over time to track their memory and thinking and brain health, including the Memory and Aging Study 2, which we are currently recruiting for from throughout Sydney. We have a number of research groups that look at different topics such as predicting dementia and looking at what are the risk and protective factors, brain imaging, memory testing, genetics, looking at people's mood and changes in personality through neuropsychiatry, and also looking at novel biomarkers of dementia. So today we're going to talk about what is dementia, what are the risk factors, what can you do to reduce your risk, and what are the resources available to us in the community. Let's start off with Joanna's story. So this is someone who I saw in my clinical role. I've just changed her name and photo for privacy reasons. We'll call her Joanna. So she came to me saying she had just retired. She's living with her husband, but she'd lost contact with most of her friends and she felt quite lonely and depressed. And she was starting to get really worried about her memory as well and starting to forget things. So I just want you to keep Joanna's story in mind because we'll come back to her story throughout this presentation. Let's talk about what is dementia. So dementia is an umbrella term for loss of memory and other thinking abilities that interfere with our daily life. The most common form of dementia is Alzheimer's disease, which occurs in about 60 to 80% of cases. And that's followed by other common forms of dementia, like Lewy body dementia, which involves hallucinations as an early sign, or vascular dementia, which is related to having a stroke, or frontotemporal dementia, which often causes changes in personality. Now, there's over 100 different types of dementia. Given it was discovered about 100 years ago, we still have no cure. And that's why it's really important that we can identify signs and limit our risk of developing dementia through our health choices. A lot of people in Australia, about 400,000, currently live with dementia. And that number is expected to double in the next 30 years. We know it's the second leading cause of death of all Australians and the leading cause for women. And given how many people are impacted by this, it's no surprise that more than 1.5 million people are involved in the care of someone living with dementia. When we spoke about the different types of dementias, we talked about Alzheimer's being the most common type of dementia, and it's often the type of dementia that affects our memory as an early sign. But this is caused by a number of changes, we think, in the brain related to amyloid plaques, these big clumps that you can see in the brain floating around in the fluid, as well as these tau tangles that you see inside the brain cells or the neurons. Both of these types of plaques have been shown to be related to issues with memory and thinking. So a lot of people ask, I went to the fridge and I couldn't remember what I went there for. Am I getting dementia? And the answer to that is no, you're not. That's totally normal. That's me 5 times a day at least. I think it's important to distinguish between common or normal forgetting and potential warning signs. So, for example, not being able to remember someone's name or a particular word is quite common as we get older. But if we can't complete most of our sentences, that's a warning sign. Similarly, forgetting something that someone said once, that's quite normal. But if you forget something that someone has said to us many times, that could be a warning sign. Another example is forgetting something that happened on a holiday. Well, that's quite normal. But if you forget that you went on that holiday altogether, that's a warning sign. So, what are the risk factors for dementia and how can we lower our risk? We know there's several risk factors for dementia. We now have a list of about 14 modifiable factors that account for about half our risk. So we think half our risk is genetic and the other half is influenced by things that we could potentially modify. You see here that the biggest risk factors are having hearing impairment and having high cholesterol. So these all are quite important, and I'll focus a little bit today on social isolation because this is the area in which I do research. So let's talk about each of these risk factors. It's really important with hearing loss that we're getting our hearing checked and wearing hearing aids if we need to. Depression is a risk factor, so it's important for us to remember that with the Medicare card, you can go see your GP and they can write you a mental health treatment plan. Now, that gives you access to 10 sessions with a Medicare rebate each year. Another thing is preventing brain injuries, and this is where falls can play a role. So if you think you're at risk of having a fall, please see a physiotherapist and improve your balance and stay aware of your surroundings. Another thing that's a risk factor is high blood pressure. So it's important that we're taking antihypertensives if we've been prescribed those medications and we're monitoring the blood pressure and heart health regularly. Obesity or having poor um, gut health is also important. So make sure that we're getting checked for diabetes, maintaining a healthy weight, and taking medications if prescribed. Smoking and drinking are risk factors. Any kind of smoking is shown to be risky, and we know that it's important to keep drinking to less than 10 drinks per week. Now, it should be no surprise that exercise is really important for our brain health. So it's important that we do an activity that's sustainable. Pick something that you enjoy because that's what we're more likely to do in the long term consistently. Could be walking, dancing, swimming, whatever chores you like to do. It's all good exercise. And sleep is quite important. So let's make sure we're getting 6 to 8 hours of sleep and sleeping before midnight. Also, what's important is that we're joining social groups because we know that these things are quite important. Staying connected is essential for our brain health. And it's also essential that we confide in someone that we trust when we feel stressed. So we'll focus a little bit now on social connections and how they reduce our dementia risk. So one shocking fact is that loneliness is as bad for us as smoking 15 cigarettes every single day. And that's because we see the dramatic effect loneliness has on our overall health. And this finding comes from the Harvard study of adult development. It is the longest running study of human happiness in the world, and it's been running for about 8 years. Another thing that we found in the Harvard study is that being socially connected can delay health conditions starting by about 10 to 15 years. That's amazing. Imagine having another 10 to 15 years of healthy years without chronic health conditions just by being connected to others. So we wanted to know, well, social connections seem to be quite important, but what exactly is social connection? And we looked at multiple factors that we count as social connections, whether we live with others, do community activities, whether we have someone to talk to, a confidant when we feel stressed. How satisfied are we with our relationships? How often do we see friends or family? Are we in a relationship? And how often do we feel lonely? And to look at this, we wanted to understand this at a global level. So we got data from around 40,000 people from all around the world, from the countries you can see here, who had been followed for up to 14 years. And we wanted to know who stays cognitively healthy and who develops dementia. Now, all the risk factors that we talked about before, we took them into account. So we wanted to know, even after we take into account all the well-known risk factors for dementia, do social connections matter? And what we found was that, yes, they do. They matter a lot. In fact, being socially connected, even after accounting for all the other risk factors, reduces our risk of dementia by half. That's a lot. And specifically, we found was seeing friends or family at least once a month, having someone to talk to when we feel stressed, and not feeling lonely that often, which reduced our risk of dementia. So a lot of people ask, well, are virtual connections good enough? And the answer to that is yes, they are. We think that virtual connections can be really protective against dementia as well. So if you have friends or family living in another city, another country, and you video call them, please do that. But we know face-to-face is more protective, but virtual connections are pretty powerful too. Often we have barriers against social interactions in our communities. There's stigma. We're starting to lose our memory or thinking skills. There's practical issues often with mobility and financial resources to go to events or social gatherings. And often people feel a lack of confidence. That's the thing I hear about the most. People often feel that once they start to experience changes in memory or thinking, that they just don't feel they'll remember information about people or their names or recognize them or know what to talk about. So it's important that you start small and start with people you feel comfortable with, because it's possible even with changes in memory and thinking to live a full life and be socially connected. And we know that's helpful to slow down cognitive decline. So if you're not sure how you can do this, the Australian government now has a not-for-profit that it funds called Live Up, which you can call and you can Call this number 1-800-951-971, and they will help you to connect you to local groups and resources to stay socially active and also physically active because they also have exercise classes they can tell you about. So, what do we do if we have noticed changes in our memory or thinking? Well, one of the things we can do is go to the Australian Dementia Network website. And if you click there on Find a Cognitive Decline Assessment Service under their Resources tab, you can look at a map of all the memory clinics that are near you, and your GP can refer you to one of these memory clinics. It's important that you go get your memory tested and you also get a brain scan if you can. So, what do we do after a diagnosis of dementia? Well, I'm here to tell you it's really possible to live a full life with dementia. So, please make sure that you stay physically, mentally, and socially active. There's many resources available. Let's have a look at some of them now. We've spent the last 4 or 5 years here at the Center for Healthy Brain Aging at the University of New South Wales to develop a website called Forward with Dementia. This is a great resource for people with dementia, for carers, and for healthcare professionals. There's helpful sheets you can print off and take to your GP to go through a checklist of what to do. And it's really useful because there's examples and stories and steps for you to follow. This is a great guide to living with dementia, especially in the first year after diagnosis. Also, please remember that we have a free phone line that's a national dementia helpline. It's open 24 hours a day, 7 days a week, and the number is 1-800 100 500. Please write this number down. It's a great resource if you have questions at any time of the day about, how to cope or how to help a friend or family member. If you're worried about changed behaviors and mood for someone that you care for, we have also developed an app called Care for Dementia, which has lots of evidence-based strategies for you to support the person that you care for who is living with dementia. This is available on the Apple Store and on the Google Play Store. So what happened to Joanna? Let's come back to her. Well, we spoke about her concerns with memory and how they might be linked to her social isolation and low mood and lack of physical activity. So I asked Joanna, what are you interested in? What did you used to do that you love doing? And she said, well, I used to love road trips with my best friend, but I haven't reached out to her in a while. And I used to love photography. Well, I said, okay, Joanna, let's go home and find that camera. So she went away. She found her digital SLR camera somewhere in her linen closet, brought it back, and she joined a local photography group and went around taking pictures of heritage houses and gardens all around Sydney. And she decided to plan a road trip with her best friend and do weekend trips with her. And she's also started volunteering to raise money for MS, which her sister was living with. And she found this combination of physical activity, social connection, and purpose really helpful. And her mood lifted and her memory got better. To help people like Joanna, we have launched, with funding from Dementia Australia, a new program to help older adults, people age 55 plus, all over our social groups completely online. You don't have to come to the Randwick campus of the University of New South Wales at any point, and you get to meet other people in small groups of 3 to 5 people for a few weeks in a row and hopefully make some lifelong friendships. So if you're interested in joining the study, please use this QR code and put in your details like your name and your email, and we will be in touch with you to help you be more socially connected for your brain health. We also do before and after memory and thinking tasks and can provide you with your results so that you can track your brain health over time. So some take-home messages today are that you can reduce your risk of dementia by staying mentally, physically, and socially active. Remember that social interactions are key to living a longer and healthier life. If you're worried about your memory, please see your GP and ask them to refer you to a geriatrician or a memory clinic so that you can do the memory and thinking assessments and get a brain scan. And if you are living with dementia or someone close to you is living with dementia, or you're a GP looking after people in the community, please have a look at the website Forward with Dementia, and also remember to call the National Dementia Helpline if you need support. If you'd like to be a nerd like me and learn all about the latest research in this space, we have a newsletter for you from the Center for Healthy Brain Aging. You can use this QR code to sign up and get bragging rights with all your friends and tell them all about the newest research in this space. If you're interested in the work that we do, you can visit our website, chiba.unsw.edu.au, and follow us on various social media channels you see here. Thank you so much for your time and for being here. I'm very honored to speak to you today, and I hope you learn a lot this week in the Brain Health Awareness Week. Thank you.
Thank you so much for that, Dr. Samtani. I'm looking forward to getting into all of the questions that have been submitted so far. There's lots of fantastic questions coming through. Um, so first off, we have a question from Zambon L. And they asked if there is any known evidence for HRT as being protective for brain health.
Thanks for the question. It is something that is quite common to get HRT. What we know is that the evidence in this space is still emerging. One of the things that's been shown to be related to no change in cognitive health is when people get CEE alone, which is conjugated equine estrogens. But there is some concerning evidence that when we combine CEE with MPA, you can sometimes increase some risk of dementia. So while we don't know that there's any protective effects, some combinations of these hormones can negatively affect verbal memory, but that's very specific.
Okay, so it's definitely something that still needs to be investigated a bit more. Yeah. Um, the next question we have is from Leanne, and she asks if you can talk a little bit about the genetic links or genetic predisposition for dementia.
Right. So let's say the genetic effect on dementia is about 50%. So about half our risk is genetically influenced. Now, this is for late onset dementias that happen after the age of, let's say, 55, 60 onwards. But some people have a extremely heritable type of dementia, which is the early onset dementia, which can begin in our 30s, 40s, or 50s. So that's much more heritable. Whereas for the more common type of dementia, which emerges later in life, we're looking at about a 50% risk from those genes. And we think that there's a specific type of gene, which is the apolipoprotein, or called ApoE. That's APOE 4. When you have two of the four types, because genes can come in pairs. So if you have 4 for the ApoE, then it increases your risk of getting dementia to about 10 to 15 times higher than other people your age. So it's if you're concerned about family history, it can sometimes be worth getting that tested for.
Okay, great. And just a follow-up question. I was just wondering if someone did have those genes or have a strong family history, is it still helpful and will it still make a difference to engage in those brain healthy behaviors, I guess, that you talked about in the presentation?
Absolutely, Anik. I think, you know, it's not at all a given if someone even has those two ApoE genes that they are going to get dementia. In fact, it's just slightly increases the chance. What is really important is that we are focusing on eating healthy, exercising, socializing, and doing brain activities to minimize our risk, regardless of that genetic risk, because half of it is still within our control.
Wonderful. Oh, well, that's fantastic to know. Thank you. The next question is from Julie O. And they asked, why are women at increased risk? Is this due to women living longer, or something else?
Yes, it is because women live longer than men. So the older we get, the higher our risk is of getting dementia. At about age 65, we have a 3 to 4% chance of getting dementia, and that number doubles with every 5 years increase in age.
Yeah, right. Okay. Thank you for that. Um, I just wanted to address, I've seen a few people in the chat just asking about the research and everything that you provided in the slides, like the phone numbers and resources and QR codes. Just wanted to let everyone know who's wondering, email will be sent out after this presentation ends, and that'll have the slides and all of the QR codes and phone numbers linked there in the email. So don't worry if you missed any or didn't write them down. They will be coming shortly. Um, anyway, on to the next question. We have one here from June. June was asking, how does dementia present with already existing neurological disorders? So are there increased risk or different symptoms? And she also asked specifically about like functional neurological disorder, or sleep apnea. I will just note that we are having a webinar on sleep and brain health on Wednesday. So we might get into that a bit more on Wednesday, but yeah, just any other neurological disorder, I guess.
That's a great question. With sleep apnea, we know that there's an increased risk of dementia with that. When it comes to other neurological conditions, it really depends on the condition. So, for example, we know that people who've had a stroke are at higher risk of developing dementia, but so far we don't have any specific evidence suggesting that other types of neurological conditions are linked to a higher risk of dementia.
Okay. Yeah, interesting. Well, I guess there's a lot a lot of different interacting factors in all of these conditions. Yeah. The next question that we have is from Slavika, who asks if there are any studies for how long COVID affects brain health. And what are the risks for dementia with people suffering from long COVID?
Well, this is something that we suspect might increase risk of dementia, but we just don't have longitudinal studies yet that follow people over time. We hear a lot about people who've had COVID and then have experienced brain fog and difficulties with memory, and we suspect that it might hasten the rate of cognitive decline for people who experience that because we're looking at multiple factors coinciding here. With COVID comes the social isolation. Sometimes people feel depressed, sometimes it affects their sleep. So we know that it's changing a lot of these modifiable risk factors, nudging them towards worse health and therefore increasing our risk of dementia. So we don't know whether the link is direct or whether it might go through these other pathways. And we really need to follow people over time to know the answer.
Yeah, I mean, I guess that's your area of expertise, those long-term cohort studies. So I guess we will see how that turns out in the research. The next question from an anonymous attendee. They are just asking with risk factors, they're wondering about sleep. Sleep is an important part of brain health, but it wasn't mentioned in the risk factors graphic. Isn't it right up there in importance as exercise? I know, again, we'll have the webinar on sleep on Wednesday, but if you want to speak a bit about that.
Well, the thing with sleep is it is quite varied for people and they experience lots of different changes in their sleep. One of the things we see with dementia is that sometimes people can um, sleep for lesser and lesser hours. While that's normal with aging, that we sleep for shorter durations of time, we don't really have it pinned down just as yet to which specific changes in sleep will increase our risk of dementia. The one that we have very clear evidence for is sleep apnea, but there's a lot to how much we're sleeping, how often we're sleeping, how deep that sleep is, and a lot of that work is still emerging. So we can't definitively say yes, but maybe there's people doing more specific research in that space who might know the answer to that. I tend to research more about the social connections aspect, and I'm less of an expert on sleep.
Mhm. Okay, yeah. No, well, we'll definitely be talking about some of the more nuanced aspects of that with uh Dr. Matthew Parse on Wednesday. So come back for that presentation if you want to learn more about the different aspects of sleep. But yeah, it is definitely very complicated. The next question is here from Leanne, and she asks, her sister passed away from Alzheimer's disease in 2023. I'm really sorry to hear that, Leanne. And once she was moved to a hospital and then a dementia ward in a home, she stopped eating. And Leanne was wondering if this is a common thing. She thinks maybe it was a conscious decision, or yeah, does that have an impact with dementia?
We think that dementia can lead to changes in behavior and changes in thinking. And it moves from a back to front sort of uh, I guess, processed through the brain where it affects the memory center and then the senses and then finally decision making and thinking. So, unfortunately, once it reaches the front of the brain where it affects decision making and thinking, people can do things which seem counterintuitive to other people around them. So, it's important to know that yes, dementia can affect our thinking and reasoning, and sometimes people can stop eating or stop doing other things which they would normally do.
Okay, great, thank you. The next question is from Elena, and she is wondering if you have an opinion on magnesium glycinate or creatine supplements. I'm guessing she means as being beneficial for brain health or affecting dementia risk at all. Um, yeah, I guess do supplements play a role in brain health or dementia risk?
We don't really know much about specific supplements and dementia risk, so I think that's something that's still unexplored. The only thing in terms of diet that we know is helpful for the brain is having a balanced diet or a Mediterranean diet or a traditional Japanese diet. These are the things that we know protect our brain because they are balanced.
Okay. Great. There was actually another question that I saw from someone who was asking if you can talk a bit about foods that are good for brain health. So I guess I know you just mentioned the diets, but um, yeah, like are there specific foods within those diets that make them really, really good for your brain or specific brain health foods, I guess?
So, the important thing here with food is to think of having a range of foods rather than focusing on having one specific food. There isn't any one specific food which has a magic bullet effect. We think the Mediterranean diet and the traditional Japanese diet from Okinawa are so good for our brain. And you see people living longer and healthier in these parts of the world because they're focusing on seafood and lean meat rather than lots of red meat. They have lots of fresh produce, lentils, fruits and vegetables, nuts, olive oil in the case of the Mediterranean diet. So we think it's really, as with all things in life, about the balance.
Mhm. Okay, wonderful. That's great. And the next question we have is from Geraldine, and she asks, she says, I've been diagnosed with small vessel disease, in May 2024. How does this affect my chances of developing dementia, especially as both of my parents have had dementia?
Well, this is something I am not really an expert on, but I'm looking at an article right now, and well, we see that if someone has white matter hyperintensities, which are small parts of damage to the connections between the brain cells, that does increase our risk of getting dementia. But to tie down specifically to small vessel disease, I think that's still an open question.
Mm. Okay, great. Thank you. I guess yeah, we'll learn more about that. Um And the next question is from an anonymous attendee, and they're asking if general brain atrophy is a precursor to dementia.
So it can be because we see in dementia that over time the brain experiences atrophy and you're getting shrinkage in the total volume of gray matter and white matter in the brain. So we see a shrinking over time. So if there is brain atrophy, that is one of the aspects we look at beyond memory and thinking tests to know whether there's been enough changes to say, look, we think this might be the start of a type of dementia. Here's your window to reduce your risk and do something to slow down cognitive decline. So if you suspect that's going on for you or someone that you love, then please get that followed up on.
Mm. Okay, that's yeah, it's great to know that there's still like care and things that you can do to try and improve your brain health even when there are things that have already changed, I guess. This question is an attendee, David's mother. Um, Hello, David's mother. And she is asking if there's a connection between memory and dementia. She says her mum has mixed dementia, but an excellent memory, which I guess goes against what we typically know about dementia. Yeah, what do you know about this?
Oh, hello, David's mom. I think that is a really, really good. question because we often have this stereotype of dementia, don't we, that it will affect memory. But like we talked about in the presentation, it's really Alzheimer's disease, which is the most common type of dementia, where memory gets affected primarily. The other types of dementia don't necessarily affect memory or sometimes don't affect memory at all. And there's 100 different types of dementia. So for example, someone might have vascular dementia where they've had a stroke and it affects their language but not their memory. Or someone might have Lewy body dementia and that leads to hallucinations, but it doesn't affect memory. Often it is a mixed presentation that people have, but it really depends on whether Alzheimer's is in that mix, whether we're going to see memory changes.
Okay. Yeah, that's really interesting. And there is, yeah, I guess a lot of stigma and preconceptions about dementia, which is such a complicated disease. The next question is from Slavika, and she asks if loss of smell is a future sign of dementia. And this is again like related to COVID-19 infection, her question. But yeah, I guess like in general, would loss of smell be related to dementia? I know hearing loss and vision loss have been, so yeah.
That's an interesting question. Unfortunately, I don't have the answer for that because I haven't come across any research that says that loss of smell is related to a future risk of dementia. What we know loss of smell is related to is increased risk of depression. So if you notice that there's a loss of smell, it might be worth thinking about has your mood changed and addressing that.
Mm. Okay, that's good to know. Thank you. And the next question is from Karen. And she said that her mother has just been moved into the locked unit in her lovely aged care home due to her aggressive behavior and wandering. And as her family, they're struggling with how to handle this. I'm wondering if you have any advice.
Well, firstly, I want to say this is quite a difficult situation that you find yourself in, but I want you to know that you're not alone in this situation. There's lots of other families in that situation as well. And it's really tough to see someone that you love behaving in a way that you don't recognize. And sometimes you can feel stressed about visiting them and guilty when you feel stressed about visiting them because of these changes. So please know that is all normal. And what's important here is to think about little things that might make them feel a little bit more comfortable when you're with them. So things like tapping into the power of reminiscence therapy, like playing songs from the time that they remember, let's say from their primary school years or high school years, music from that time, old photos from that time. Things like that can really help them be where they feel comfortable and re-engage those feelings of being social and being happy, and that can help them to feel a little bit more happy in those moments when you're with them.
Yeah, it is a very hard and complicated situation, but thank you so much for that, Dr. Samtani. That's great great feedback. My grandpa was also moved into a locked area, so I definitely relate a lot to Karen and everything that you said really resonates. Um, the next question is from an anonymous attendee asking if you can please explain how hearing impairment can cause dementia. Like, what's the exact link there?
Well, the link between hearing impairment and dementia is that when we stop hearing, often what we're doing is we're stopping our cognitive activities and social activities. So we withdraw from people because initially, when we're in a group or a crowded place, we can't make out the sound of a single person because there's too much background noise. So we reduce our interactions to one-on-one, and then maybe if that gets too difficult as well, we just stop interacting with people, or we're in that social setting and we just feel unsure what that person has said and we're smiling and nodding along because no one wants to look like they're not following the conversation. That's totally human. And so we tend to sit back and worry that people will spot that we don't really follow the conversation. And the more we're sitting back and not engaging in that conversation, the less cognitive stimulation we're getting. And it's that loss of practice with language and memory and thinking that then increases our risk.
That's really interesting that it's not the hearing impairment directly. It's yeah, I guess like a bit more complicated than just the straightforward risk factor. The next question is from Janine. And they asked if you have any thoughts on the brain games debate, if brain games can help with improving your cognition.
Well, we know that doing cognitive activities is really, really good for our brain. So doing some sort of, things like Sudoku, crosswords, puzzles, things like that that involve remembering things is all really good for our brain because our brain lives by one rule, use it or lose it. So any kind of practice is good. Now, when it comes to brain games specifically, the jury's still out there on which specific brain game is going to be helpful. There was a lot of interest in certain apps that then didn't turn out to be that effective. One that we know now that might be quite effective is Nation, and I think a lot of people are subscribed to that and using that, and we think that's probably a good evidence based one. So if you're interested in something like that, I think that might be a good option for you. But anything you do from reading the news to listening to podcasts, any cognitive activity is good for you.
Mhm. Yeah, no, that's a fantastic point. And I have also heard that like from other articles and stuff that I've read, I don't know how true this is, but that it's kind of about changing things up and making sure that like these activities that you're engaging in are, I guess, like still challenging for your brain. Like maybe if you do the crossword every single day and you finish it in under 5 minutes, maybe try a Sudoku or something. I don't know how true that is, but yeah, changing things up can maybe help. Um,
I think that's an awesome point, Anik. It's
yeah.
great to challenge our brain. That's what, pushes it to grow and to stay healthy. It likes a challenge. So please pick something that is challenging for you and mix it up. I think you have a great point there.
Yeah. Also, sorry, I just saw a message from someone in the chat saying, asking what the neuro app that you just mentioned was. Maybe if we could, I'll just like, type out the name in the chat so that people can see how it's spelled.
I think it's Nation. So Neuronation.
Okay, great. Um, Wonderful. The next question, is from, an anonymous attendee, and they're asking if it's possible to overcome dementia.
Well, we know that it is neurodegenerative and that generally over time things get more difficult and worsen over time. But what it is possible to do is still live a life that's full and beautiful and socially connected and meaningful, even with dementia. So I think we moved away from this idea that dementia is some sort of, terminal illness to more of treating it like any other chronic illness and still finding meaning in our life because it is really, really possible to live a full life. And we see a lot of people still doing things that are quite fun and full of love and light and just enjoying themselves, even if they're living with dementia. I think it's possible to live well with dementia. So please remember that.
Mhm. That's a fantastic thing to keep in mind and really important. Thank you for that answer. The next question, let's just try and fit in a few more before in the last few minutes. Um, uh, Chui Shan asks if there's any association between concussion and dementia.
So we think there might be a link. the jury's still out there. We know if it leads to a traumatic brain injury, that definitely increases our risk of dementia. We're starting to suspect that people who have lots of concussions might be at higher risk, but that definitive evidence is still yet to arrive.
Mhm. I guess also we will talk about this a little bit more just about concussion and traumatic brain injury in general in tomorrow's presentation. So anyone who has further questions about concussion and long-term effects, make sure you come back tomorrow. The next question is from Rachel, and she's asking if there's increased dementia risk with chronic migraine. I guess migraine is super common, so it'd be good to know if there is, yeah, any kind of links there.
Well, I don't believe there is any evidence right now to suggest that chronic migraine increases our risk of dementia, so I wouldn't worry about that.
Okay, fantastic. Thank you. The next question is from Julie Barnett, and she asks, she works as a dental nurse for many years with exposure to mercury vapors from amalgam fillings. Do heavy metals increase your risk of dementia?
This is a good question. I don't really know the answer to that, but it might be possible that there is a link, but we would have to look at the research out there to see is there any link that's been found. We know that certain things like mercury poisoning back historically were not good for brain health. So whether they would be in that dose, in that form, I'm not really sure.
Okay. Okay, great. Thank you. And I guess just one last quick thing. Oh my gosh, we're just about to end, but Larry was wondering if you have any book recommendations, and I just thought that would be a great note to end on. If there's anything that you'd recommend to people who want to learn more about this topic.
Well, there's lots of different books and movies as well that show us what the experience of dementia is. One that sort of stayed with me is the book Still Alice.
Hmm.
And I think they made that into a movie as well, where Julianne Moore plays the title character of Alice, who experiences cognitive decline and then is diagnosed with dementia. So that's the one I would recommend because it gives you an insight from the person's perspective of what it's like going through those changes, and that is just really invaluable.
Oh, wonderful. That's a great recommendation. Thank you so much. Well, now it's 1 p.m., so we'll need to wrap things up for today. But thank you so much for your time today, Dr. Samtani. That was such a fantastic presentation. And it was so wonderful to have everyone here. Thank you, everyone, for your fantastic questions. We will make the recording available as soon as we can. And we hope to see you in our other webinars this week. Thank you so much, everyone. Bye.
Thank you.